meeting recorded.
Texas Children by Don't Mess with Texas Team 1. As of 2015, 9.5% of Texas children were uninsured, the second highest level in the country, accounting for over 682,000 children. Thank you.
Evaluation criteria used to analyze each proposed alternative include economic feasibility, where financial aspects were evaluated, political feasibility, that takes the conservative perspective of Texas into the state consideration, as administrative operability that looks at organizational support and involvement in the proposed alternatives. First, we will look at the status quo.
They are insured by the purchase of insured premiums from health insurance brands, which are linked through employers. Then the premium is the cost paid monthly for insurance plans selected by the consumer. Different types of plans provided by the brands to choose from. These plans may be high deductible health plans. These plans exist. They are not always provided through the workforce, which sometimes unaffordable for some Texan citizens. Employers do not provide health care benefits, which they purchase insurance premium, which are not always affordable through the Texas marketplace. Medicaid and CHIP programs help cover medical expenses for children and people with disabilities who need income. Next is Jessica with the feasibility.
Feasibility, low confidence in federal reimbursement for Medicaid coverage long-term, insurance premiums too high for family-dependent coverage through employers, increase in consumer-driven health plans, higher deductibles, higher out-of-pocket costs, and costs associated with misuse of fraud, which also causes for a diverting of funds that could otherwise be legitimate for other healthcare services. Next. Feasibility. This is a conservative state, inability willingness to cover Texas' large number of undocumented residents, which is intended to reduce illegal immigration and protecting public resources. Tax out of enrollment assistance programs. It is 90 days. 647 is terminate waiting period altogether, and the House Bill 1349 is to reduce the wait period to 30 days. Over to Terrence.
One alternative of uninsured children in Texas is implementing the wellness program in our state. One program in particular is the Alliance for Healthier Generations, with many pros and cons. One pros is improve the public health, with 90% of calories that are being shipped into our Texas schools. One con is the cost of the program, which is $2 million in revenues, which help fund programming, development, and administrative costs. Other pros and cons of wellness is lowering health care costs due to healthier populations, job creations, grant funding support. Some cons are difficulty monitoring programs, cost of engaging the community. Political policy is a lower cost as alternative to insurance programs, more inclined to bipartisan acceptance, appealing to nature of child advocacy, and the opportunity to lobby for funds from private foundations, community organizations, and government agencies. It requires a skilled workforce, which makes them trainers or physical ed staff, and difficulty in standardizing across school districts with the ability to get schools to monitor progress and really getting students to continue the progress once at home.
Is the adoption of Medicaid expansion. Effective 2014 through 2016, the federal government has cut 100% of state costs of Medicaid through the ACA Medicaid expansion program. Just after 2016, the federal match rate gradually declines until the year 2020, and the match rate will level out at 90%. In 2018, Texas spent $42.9 billion in health care costs alone, and only $43.6 was federally funded, and it could have been more greatly matched had Texas adopted Medicaid expansion. Political for Texas political reasoning, their decline in Medicaid expansion surrounds the belief that federal funding will fail. However, stakeholders in favor of Medicaid expansion argue that Texas would experience gains of approximately $1.8 billion in tax revenue over a 3-year period. Admittedly, Texas made enrollment for current Medicaid programs to be a challenging process. To get this and increase health insurance for children, Texas can create programs to identify eligible families and provide assistance tools necessary to educate and enroll eligible persons. Thank you.
State components when attempting to implement new policies. States that we contacted consist of the Children's Health Coverage Coalition, Michael Burgess, the Children's Defense Fund, Dr. Humana, pediatricians, and the Vice President of the Diabetes Health and Wellness Institute. We did find that without a contact to assist with that meaningful discussions were difficult to obtain. In large, competitive, and extremely fast-paced cities such as Dallas and Houston, airtime is hard to come by. There were numerous unreturned voicemails and several organizations that directed the inquiries to an email which would remain unanswered. The representative also denied our request due to being outside of his district. Fortunately, however, persistent networking within current healthcare jobs allowed for several successful stakeholder conversations, a few of which we will review further here. Tammy Dawson is going to go more in depth on her experience with the Children's Defense Fund before review our interviews.
Thank you. The Children's Defense Fund is a 501c3 organization who has a top priority of addressing the parents' needs on to Medicaid, the Children's Health Insurance Program, and the Affordable Care Act, which affects coverage for 95% of all children in America. We were actually able to contact the Executive Director, Patrick Britt, and his colleague, Casey Anderson, to determine a method to receive feedback regarding status quo and alternatives 1 and 2. We sent an email and followed up with them twice, and with much disappointment, we were unsuccessful. But at this time, Brian Felty will present a successful attempt to obtain feedback from stakeholders.
Thank you. The first one we were able to speak to was Dr. Catherine Levy, who is a pediatrician in Dallas, Texas, also a local board member of an ACO, account care organization. While she agreed that the status quo was not a long-term alternative as children needed to get covered, she believed in our alternative number 2 that the state of Texas needed to figure a way to expand the coverage of children through government-funded programs, as that would allow them to come in, see the doctor, as well as have the opportunity to get high-cost care, such as hospital inpatient stays and outpatient visits. Our stakeholder, however, because he works within the Diabetes Health and Wellness Institute in Dallas, Texas, believed that the lower-cost alternatives, such as wellness programs implemented throughout the state, would not have the ability to outreach for children and families, but it would do more long-term by educating families and young children, especially these unborn children to new first-time moms, the first 3 years of life within for a child is vastly important to the brain development. She believes that by reaching out to the children, we would have a greater impact long-term at reducing overall health care cost.
Alternative 1, the wellness program, is what we are proposing to combat Texas's problem of uninsured children. This program at a state level can be economically influential, as discussed. Molded to living healthier lives from a young age would lower healthcare costs on a broad level for long-term impact. Admittedly, this would be difficult, however feasible given its reduced cost compared to Alternative 2 Medicaid expansion. This quote is unacceptable, and changes must be made to really high rate of uninsured children in Texas.